Hi, today this is going to be my Nursing 320 head-to-toe assessment and partial full physical assessment. So some aspects are excluded for obvious reasons. And with that, we'll get into it. Alright, we're going to start by inspecting the head. So we're going to look at the scalp, the hair, and we're also going to palpate the head. There shouldn't be any lesions or any pain anywhere. Then we're going to move on to palpating the temporal pulse on both sides. Should be equal. And then I'm going to palpate the temporomandibular joint and then have the patient move their jaw down and then side to side and close their mouth. And then we're also going to be looking for symmetry with facial expressions like smiling. So could you smile for me? Yeah. We're moving on to the assessment of the eye. So we can start by looking at the conjunctiva and the sclera. Should be white. We can also look at the pupillary reflex now that I have my pen light. Alright. And Perla is present. Everything is good with that. Now I'm going to do the corneal light reflex. Please look at me. And then I will assess visual acuity with a Snellen chart. I printed out one. It's a little bit smaller than the standard Snellen chart. So we will obviously be doing it at a closer distance, and in a clinical setting we would be doing this test at 20 feet with the standard Snellen chart. Alright, could you please read the smallest line that you can?
PECFD.
Alright. Thank you, that was good. And then I'm going to test your extraocular muscles with the 6 cardinal positions. I'm going to have you sit down first. And then follow my finger.
Oh.
There should be no nystagmus present. There was not. And then we are going to do confrontation, which we're going to cover the eye with an opaque object so that you can't see, and then I'll be testing your peripheral vision, okay? Alright, ready? I'm going to kind of get a red line.
Now. 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 No.
Alright, now then we're going to do the other side.
Now. 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 Now.
Alright, good. Alright, now we're going to move on to the examination of the ears. So I'm going to start by inspecting the ears. And the ear canal. And just looking behind the ears. There shouldn't be any lesions. And then when you palpate the ears, there shouldn't be any pain. Whoa. Okay. And then I'll have you sit in this chair. And then I'm going to perform the whispered voice test. So I'm going to be arm's length away. And then I will I'll occlude one ear. And then I'll whisper letters and numbers, and you have to tell me what you hear, okay? 6, 8, 8,
6A 8. B2 1.
Alright, that's good on that side. Then I'll have you turn to this side. Alright. Okay. And then we'll just occlude this ear. And I'm going to do the same thing, okay?
A B 5. FG 7.
Okay. Good on both sides. Move on to the assessment of the mouth and the throat. So I'm going to don some gloves. And then grab a tongue blade. And since there's no history of smoking, I don't need to do a full palpation, and the patient is not over the age of 50. I'm going to just grab my pen light and start by inspecting the lips and the mouth. The color should be a little bit pinker or darker depending on your ethnicity or race. And then I will just kind of peel the lips down to see if there is any abnormalities. So I'm just going to go like that. Look on the inside. Oop. Then we can also see the gums at this time. And it's pretty vascular. There's no lesions present. Everything's normal with that. And then could you open your mouth for me? And we're looking inside on both sides. And then we're looking at the teeth on both sides. Should be no broken teeth or anything in there, and everything's normal. And then could you stick your tongue out for me? And then in your mouth, could you stick your tongue up to the roof of your mouth so we can see the bottom? It's very vascular, and there is no abnormalities. No jaw pain or anything. And then I'll just palpate, light palpation. Can you open your mouth? Also, can you stick your tongue out to the side? I'll hold it a little bit so I can see. And then the other side, we're just looking to see if there's any lesions, and there's no lesions present anywhere. Everything's normal. And then I'm going to assess the gag reflex. Okay, gag reflex is present. So now we're moving on to the neck. We're going to inspect the neck. There shouldn't be any lesions present anywhere on either side. And then we'll go ahead and palpate. Shouldn't be any pain present. Alright, and then I'll move on to palpating the lymph nodes. So, kind of. Alright, there's no swelling present. Everything's normal with that. No pain anywhere in your neck. Now we're gonna move on to range of motion. So can you move your necks left to right? And then, yeah, and then side to side. And then up and down. And back. Alright, and then can you do it against resistance? Alright. Alright, and then, no, you'd move your ear to your shoulder pretty much. Just like this. But against resistance, no? Okay. All that is normal. And I'm going to go ahead and palpate the trachea and the thyroid gland. So we can, I'm going to just apply some pressure right here and palpate the trachea and then some on this side. Okay, and then I will go ahead and palpate the thyroid gland. So I'll have you move your head a little bit to the right and forward, and then I'm going to palpate with this side and kind of hook in, okay? And then I'm going to move your trachea over a little bit, and then I'll have you swallow. All right, and there shouldn't be any swelling or masses there. Okay. Go on to palpating or assessing tactile ephemeris, but I'll go ahead and palpate as well. There shouldn't be any pain present anywhere. Well, we'll put it in the camera angle to see. Okay, now I'm going to take my stethoscope so I can auscultate the lung sounds. And I'm just going to warm up the diaphragm. And then listen. Could you take a deep breath in and out for me? Deep breath in and out. And in the clinical setting, I would do this under a gown. Deep breath in and out. Deep breath in and out. All right. And then I would displace the breast tissue so that I'm not listening over it and getting inaccurate sounds. But I will listen to the lung sounds on the back now and have you lean forward like that, and then I'll just spin the chair around. Oh. Could you take a deep breath in and out? Deep breath in and out. All right, and I'll let you take a break so you don't get dizzy or lightheaded, and then I'll listen to the lung sounds laterally. All right, now I'll listen to the lung sounds on the lateral sides. Can you take a deep breath in and out? All right, and then this side. Okay. And then I will be assessing tactile fremitus now. And chest expansion. We'll start with chest expansion now. All right. I'm going to just place my hands here, and then my thumbs should separate, and my fingers should separate in equal manner whenever you take a deep breath. Take another one. Yep, equal. And then I'll do it on your back as well. Alrighty, can you take a deep breath in? Oh. Deep breath. Okay, that's good. And then I'm going to just assess for tactile fremitus. And I'll have you say the word 99.
99.
Say it again.
99.
Say it again.
99.
Say it again.
99.
Say it again.
99.
Can you say it again?
99.
Okay. Alright, and then I'll have you do it on the front. Say 99.
99. 99.
Alright, you're good. And then I will move on to the next assessment. Alright, now we're going to move on to the examination of the neck and heart vessels. So I'm going to start by palpating the carotid pulse. Alright, then I'm going to move on to finding the apical pulse with one finger pad. Alright, and then I'm going to move on to auscultation, and then I'll be checking the jugular venous pulse in the supine position. So in the clinical setting, I would obviously be able to displace breast tissue easier and close easier. So I'm going to do my best to demonstrate the correct positions. But just being said ahead of time, I would always assess starting with the second intercostal space on the right side, moving to the left side, and then I'll move down to the fifth intercostal space, and then I'll assess medially near the sternum, and then laterally, and then that will be in order would be aortic, pulmonic, tricuspid, tricuspid, and then mitral. And just to verify, aortic, pulmonic, tricuspid, and then mitral valves. And I'll be listening with both the bell and the diaphragm. And I'll start with the bell. I'll warm it up. Then move over to the pulmonic. And then displace the best I can. Okay, and then I'll be moving over to the bell. And then I'll have you lie flat. To inspect the jugular venous pulse.
Alright, now I'm going to inspect the jugular venous pulse. I'm going to have you leg facing that direction, and then kind of put you in a 35 to 45 degree angle. Yeah, that's good. And then, I'll feel right. Present. Okay. You can get out of that. Now we're going to move on to the abdominal assessment, so I'll have you lie flat for this whole assessment. In the clinical setting, I'll be able to look under the gown, see the skin, show that for privacy reasons. I'm obviously not going to do that today. What I can see is it's really flat. It is flat, and then I can also feel that your stomach's flat and there's no distension. So I'm going to go ahead and move on to auscultation, starting in the right lower quadrant. Now move to the right upper quadrant. And the left upper quadrant. And the left lower quadrant. And you can also listen to breathe at the top. There's none present. And then I'll do some soft palpation in the same order. And then just ask me if there's any tenderness. And is there any tenderness present? No tenderness present. Okay. And then that completes the abdomen portion of this full assessment. And I'll be able to inspect the skin in a greater depth with a clinical situation, because I'll be able to move the gown around and be able to see the skin and the contour of body parts. But for this, we will just be sticking the leaving the patient closed, or I hope it closed. And you can set up for this next portion of the assessment, and you can face the camera, and I'll be moving on to the assessment of the upper and lower extremities. So, can I see your hands? We'll just be looking at the nails, the hair, skin, cuticles, and the palms of the hands, obviously, and then going down to the feet. We're examining the same thing on the nails, looking for any abnormalities, and skin and the hair distribution. We're looking for regular grooming and just a general healthy appearance. And then now I'll move on to palpating. So there shouldn't be any tenderness anywhere, any nodules, nothing firm. And then I'll palpate the legs as well. The lower extremity. Looking for the same. Here's the tenderness and the redness and swelling in the feet. There shouldn't be any edema present, and it's all normal in this case. And then I'll assess calf refill in the hands. And you can depress it. You depress the fingernails for 5 seconds. And then just watch for a fast return. And then the same with the feet. And I'll just bring the camera down. Just really depress it. 5 seconds. And release it. And it should be less than 30 seconds. And I can palpate fetal pulses. They're both present. I can get my camera angle here. I can feel both at the same time. Alright. And then I can also palpate the radial pulses. And then check the skin surgery near the clavicle. And it responds quickly.
Now I'll be doing the musculoskeletal assessment, so I'm going to have you turn around to just start by assessing your spine. And I'll just start by palpating, feeling for any nodules, any tenderness, any pain, and then I'll just feel around there. Okay. And then I'll have you lean to the side like this as much as you can, both ways, and then twist. And then I'll have you try and touch your toes. You don't have to touch your toes, but bend at the hips as much as you can. That should be a 90-degree angle. And then I'll feel your shoulders. There shouldn't be any pain or nodules or any tenderness there. And I'll have you raise your arms straight up like this. And then bring them down behind you as far as you can. And then I'll have you raise your arms up to the side like that. And the same way, we'll see how far you can bring them in this way. Yep. And then I'll have you put your hands behind your head. Yep. And then your hands behind your back. And straight. Alright, that's good. And then I'll have palpate your elbow. So I'm going to just feel the crook of your elbow. and then on both sides. Alright, and then I'll have you bend your arms like this, straighten them out. Alright, that's all normal. And then we'll be taking a look at your hands and palpating the joints in your wrists. And your knuckles. Shouldn't be any nodules as well. Pretty much all the same for all the joints. And then I'll palpate each individual finger joint like that on both sides. Just checking. And then I'll have you make a fist. And then can you squeeze both my hands? Alright, that's good. And then I'll have you move your hands like this at your wrists and then go up like that. Alright, and then I'll have you do the same thing but only with your fingers, and then up with your fingers. Alright, and then I'll have you touch each tip of your finger on both sides, and then put your thumb at the base of your pinky, like that. Yeah, that's good. And then I'll have you put your arm on the bed, like this. And then I'm going to just have you rotate both ways. And then I'm going to assess your strength in this wrist. So can you pull just with your wrist? There you go. And then same thing on the other side. Alright, that's good. And then I'll have you pull against my elbow, or pull against my hand. Alright, now push against it. Okay, same on the other side. Pull. And then push. Okay. Alright, now I'm going to palpate your hips and your knees. So I'm just going to move to palpating there. And then feeling all around the knee joint. There shouldn't be any tenderness or pain. And then we'll palpate your ankles. Should be camera angle. Alrighty. And then I'll have you move one knee at a time, but I'll have you tuck one knee to your stomach. And then the other one. Alright, and that's good. And then I'll have you bring one up without bending your knee. And then the same on the other side. Alright, that's good. Then I'll have you move your leg out and in. Yeah, with both legs. Not at the same time, just one at a time. There you go, that's good. And then I'll have you put your knee up and then on the bed like that, and then bring it in and then also bring it out. Like move it this way and then move it the other way. And then move it that way if you can. And then I'll have you do the same with the other knee. Alright. That's good. And we use the blanket for modesty purposes. And then moving on to the knee, well, alright, I'll have you stand for this next portion. And then I'll have you bend your knee. Well, just kind of like this. And then straighten it. Yep, on both sides. Alright, that's good. And then, alright, I'm going to have you point your toes to the sky, and then point them down to the ground, and then do it against resistance. And against resistance like this. And then can you turn your feet inward, like sideways? Okay, that's outward, and then do the opposite. Yeah, that's good. Alright, now I'll have you lift your knee up against resistance. Alright, and then same on the other side. Okay, and then turn this way. And then just lift your leg up against resistance. This one, kind of just pull up, yeah. And then same on the other side. Okay, that's good.